Do you feel like it's changed at all?
Patients and physicians got a windfall this week after an important bill to lift the burden of prior authorization had a surprise hearing. The bill, House Bill 3459, would streamline prior authorization requests to simplify and expedite patient access to health care.
I'm here today in support of the bill.
Austin oncologist Dr. Debra Patt, chair of TMA's Council on Legislation, testified for the bill, along with San Antonio radiologist Dr. Zeke Silva and Houston internist Dr. Lisa Ehrlich. Dr. Patt, who was invited by the bill's sponsor, Senator Dr. Don Buckingham, described prior authorization's costly delays and their mental and physical toll on patients.
Prior authorization in its current state delays, detours, and diminishes care. It causes an increased burden on patients, and the natural consequence is adverse patient outcomes.
Key measures in the bill would give one-year gold card status to physicians whose prior authorizations are approved more than 80% of the time. The bill also would require prior authorization peer-to-peer reviews to be conducted by a Texas-licensed physician in the same or similar medical specialty.
We're required to practice, to have a license in the state to practice, and if we're going to have decisions made about our patients in our state, those decision makers engaged in that peer review process should be under the same standards which we are within the state of Texas.
The Senate Finance Committee unanimously approved the bill, sending it to the Senate floor. May 26th is the deadline for Senate bills to complete their second and third or final readings. The legislative session concludes on May 31st.